Recently, I've been involved clinically in a study using Veyetals as a measurement device for patient vital signs. The technology is based on photoplasma. Can you fill that in for me? Um, Plasmography. And I've been very impressed by the device, the ability to obtain patients' vital signs without having to have multiple devices in the office that need to be maintained, paid for, calibrated. The ability to have one device to measure multiple things. Some measurements I'm unable to do clinically now, such as heart rate variation or mental stress evaluations. So it's bringing to me a host of other parameters that I can use in decision making to take care of the patient. It is contactless, so there's no risk of disease transmission associated with it. There's no need for cleansing of mechanical devices from patient to patient, which means that you can increase your throughput in the office flow. It also means that your MA or nurse can multitask while this measurement is being taken. I think, to me, though, the biggest benefit is using it in the remote space, such as remote physiologic monitoring. I'm a pain physician. My biggest concern is patients tolerating the medications that I give them safely. And for my patients to be able to send me their vital signs instantaneously when they need to or on a daily basis is extremely reassuring to be able to know what their pulse oximetry readings are, what their respiratory rate is, how their heart rate's doing. All these things are important with chronic opioid therapies. And I would see this as beneficial in any specialty that is close to the critical care type of management: cardiology, pulmonology, intense internal medicine, or family practice patients. It's a good indication for all of them. And then lastly, the ability for this to be pushed out through Android or Apple for the patient to be able to have the reassurance when something doesn't feel right, to be able to get their vital signs, look at them, is reassuring, and to be able to push that, as I mentioned earlier, to the physician, for the physician or the provider to interact with the patient is critical, and also can be a universal cost savings when those measurements are used to prevent patients from having to go to the ER or to go to the ER in a timely manner. So I wholeheartedly endorse Veyetals.